And we are recording this session today, so if you know of your other colleagues or friends or even family that might benefit from the messages today, please be aware that we are recording this and it'll be available later. So I see some nice activity in the chat. Thanks for your kind words and welcomes. I think we're going to get started though. Fleur, what do you think?
Yeah, I think we should get started. That's great, Greg. Thanks.
Yeah. So welcome everyone. I just would like to start off by acknowledging that the land that I'm living and working on, the territories in Saskatchewan, the Nehiyawak, the Nishnawbek, the Saulteaux, Dakota, Lakota, and Nakota, and the homeland of the Métis and Michif nations. I want to welcome everyone joining from in Saskatchewan, and I know this invitation has went out farther and wider than Saskatchewan. So welcome everyone across either the ceded or the unceded territories in Canada. The land is really, really important to me. I'm a third generation settler on my dad's side and many, many hundreds of years French Canadian on my mom's side. So still have farmland that I'm working hard to kind of decolonize and take down some of the settler structures. So that's part of my, kind of bringing things back the way they were before. Just a few housekeeping notes for today's talk. Please keep yourself on mute to help with the background noise. We'll be recording, as I've said, the session today, and it will be available for sharing online afterwards on the FMHRN website. We will be monitoring the chat, Fleur and Rhonda, and probably myself. So if you do have questions during the presentations, please feel free to share them, or you can actually unmute yourself or use the hands up. I'd like to thank the co-hosts for this event, the First Nations Métis Health Research Network and Métis Nation of Saskatchewan. And just a reminder and a little bit of a plug for our next webinar. The next webinar is the first of a three-part series, Racism in Healthcare, Creating Systems Change. That'll be happening on April 15th of 2021, and that's again from 12:30 to 2. And Dr. McKinney will be joining us again for that, alongside of some other leaders in provincial professional associations, health authorities, and more. Again, my name is Greg Reel, and I'm a registered nurse. And some of you do know me. I've been a registered nurse in Saskatchewan for almost 30 years now. And today I'd like to thank Dr. Veronica McKinney for joining us to talk about the COVID-19 vaccines and some of your questions that you may have. Dr. McKinney is the director of the Northern Medical Services, which provides healthcare services to 40,000 people living in Northern Saskatchewan through agreements with the First Nation, with the First Nations and Inuit Health Branch, Indigenous Services Canada, and the Saskatchewan Health Authority and the University of Saskatchewan. Dr. McKinney, who has Cree and Métis ancestry, is a graduate from the University of Saskatchewan's medical school, and she has decades of experience as a frontline practitioner, professional, and healthcare leader in Saskatchewan. She was named Physician Leader of the Year by the SMA in 2020. We are co-hosting this discussion with the Métis Nation of Saskatchewan and have with us today Marg Friesen, Métis Nation's Minister of Health, to talk to you a bit about what they are seeing and how they've been supporting Métis citizens through this pandemic. We also have Adele Panay, the Director of Health for Métis Nation, who may also be supporting Minister Friesen today. Also with us here today is Judy Pelly, whom most of us will know, who's a cultural advisor and a Saulteaux elder from the Cote First Nations, to talk about her experience getting the vaccine and what she sees in her community. And we'll start off with some brief remarks from Dr. McKinney and Minister Friesen and Elder Judy, and then open up your comments. And probably I'm going to start with Elder Judy to start us off, if that's okay, Elder Judy.
Okay. I know there's been recent conversations, but I wanted to first of all say that I'm only speaking on behalf of myself and my lived experience. I was born and raised in Cote First Nation. I was raised with elders and with traditional people. I attended a lot of ceremonies growing up and as I got older. But I've also been a resident of Saskatoon community for 52 years now, as I came here as a teenager. And so I've seen the population, the evolution, like I said, from barely seeing any Indigenous people anywhere when I first came, and to now, you know, that we're everywhere we see. So, and my first early experiences as a health, working with the health department, the department head for SIIT with community and health studies, and I retired from there in 2015. And now I work with, I'm a contractor, but primarily for the Saskatchewan Health Authority, mental health and addictions, adult outreach, and other contracts with small, you know, I work with healthcare researchers in healthcare. I work with FNUC and the University of Saskatchewan and provide support there. I work with both with the RCMP and the city police as an advisor. So I'm all over the place. But I also belong to, specifically that I'm very proud of, to belong to a survivor group of elders or old people. We don't like to be called elders. We prefer knowledge keepers now. We just so when we felt that it was a colonial term, elders, and so now we prefer to be called knowledge keepers. So with that, I will tell you a little bit about my own experience. I know there's a hesitancy in First Nations communities to take the vaccine, and also what I think is attributed to that is I will say that a little bit later, but I think I'll just introduce myself that way, and then as the conversation goes, I will share a little bit more. And I really feel honored to be a part of this committee, and I look forward to our conversation. Miigwech.
Thanks, Judy. Very good words to start us off. And if we can hear just some opening remarks from Dr. McKinney, that'd be great.
Hi, well, so there's lots to talk about. I guess I just want to give a little recap about what do we actually know about COVID so far. I think one of the things that's hard is that it's the information that we have is always changing and evolving. So we know COVID-19 was a virus that's new to our human population. It came from animals and was spread to humans. And because it's new, it makes us all very vulnerable to getting this virus. Often it's from a family called coronaviruses, which often cause respiratory illnesses. So often things like the cold type symptoms, but you can also get vomiting and diarrhea and other things as well. The concern with this virus is that it can lead to quite severe disease and also can lead to death, of course, and at higher rates than what you would see with just a normal flu bug, for instance. We know that people who are elderly are much more prone to that more severe illness compared to the young. And we know that, you know, it's easily transmissible, this virus, so it's easy to spread. We do know that wearing masks, washing our hands, keeping socially distanced, which means 6 feet apart, really helps. And just to give you an idea of how well it helps, normally we'd be seeing a lot of people in the emergency departments and in the hospitals with normal flu and cough and cold that's gone really bad and led to pneumonia. We haven't seen that this year. So it really tells us that what people are doing is actually working. We know that in Saskatchewan, as of yesterday, that there were 33,399 positive cases of COVID and 434 deaths. Some of the things that we're learning a little bit more about it now are how many people are going to have long-term effects. We know that if people have been in the hospital, 3/4 of them will have ongoing symptoms for up to 6 months later. So this is a virus that's different than others because it causes some of these different things for sure. I want to give a little plug to Northern Saskatchewan in saying that we experienced the virus up in the north back in April of 2020, and we haven't really had a break from it. We had maybe a little bit less back in August, but that's it. So you can imagine the ongoing burden for our population when we see that. And in Northern Saskatchewan, which is basically the northern half of the province, greater than 85% of our population are Indigenous. So we have Dene, the Dene, the Nihilwan, we have our Michif, but we're experiencing this in all of our communities. And so we're really being able to see some of the disparities that we know have always existed, but they are being highlighted that much more. And that whole idea of systemic racism is front and center for our people. Some of the challenges that we have up north around our food, our housing, all of those things are just exponentially being highlighted because this virus is really having a big effect. So I know I'm supposed to talk about the vaccine, so I'm going to talk about the vaccine now and shut my mouth about everything else. So there are vaccines available, which is fantastic. Some, we were able to get these vaccines out and going actually relatively quickly. And that's because there was work being done on vaccinations, not specific to corona, but just general type of vaccinations that was done for many years before we ever got to this point. And so when we got the coronavirus and when we saw the devastation it was causing, the companies were able to modify the work that they'd done and put it towards the coronavirus. And that's how it came out so quickly and why we have different types of vaccines. So I just want to explain very briefly what those different vaccines are. People are becoming very familiar with the names. There's the Pfizer, which was the first one. That is the one that you have to keep it ultra cold, so minus 70 degrees. That makes it really challenging when you're trying to transport this vaccine. And so that's why it's available in more of our major centers like Saskatchewan and Regina, Prince Albert, for instance. It's very effective. And what we look at when we look at how effective things are is the goal of these vaccines is to keep people out of the graveyard and out of the hospitals. We don't want severe illnesses. You may still get some mild symptoms, but you're not going to get the really bad end of things. We don't know in terms of long-term effects, these long haulers that people are called that have ongoing effects. So we think that the vaccines will reduce that as well, but we still need some more evidence around that. It's based on a technology that actually uses our own cells to make the protein a piece of the protein that the virus uses. So it's like if you were to take plasticine and put it on your hand, you'd get kind of an imprint. So it takes a little imprint of just a small piece of one of the proteins, and then it allows your body to make that protein. So you're using your own body, so your body's not going to have any bad reaction with that. But it does recognize that protein as being different, so it forms antibodies against it. So that means it kind of takes the picture and says, hey, that's the bad guy, get that guy out of there. So you're able to do that with this particular vaccine. It's very safe. It's very safe in particular for people who are immunocompromised because you're using your own body's symptom. You're not introducing something foreign. So a lot of people worry when they hear something like messenger RNA, they think, does that mean it's going to change my cells and all these things? No, it can't get into the nucleus. It's what's called messenger RNA. So that's only uses your cells production to do it. So that's in a place called the mitochondria, but it's not going to cause anything like that. So anyways, that's the Pfizer. Moderna uses a very similar type of process. It's called the messenger RNA. It's also very effective, but the storage doesn't need to be quite as cold as the ultra cold with the Pfizer. So that one is one that we've been using in our north, in the far north, but in other rural and remote areas as well. Both of those require 2 injections. We now realize that it's better to space them out further. So up to 4 months is considered good. And in fact, there's data to show that when you do spread it out, you get better efficacy. And then the other vaccines, AstraZeneca, which we seem to be hearing a lot about in the news, has become available to us. We are getting our AstraZeneca out of India and out of the United States. And so it uses a different mechanism to introduce that protein. So the mechanism it uses to get in there is an adenovirus, a virus that causes like cough, cold, but it's denatured. It's not the whole virus, so it can't make you sick with cough, cold, but it can bring that little piece of the protein into your cells. So again, those pictures can be taken and your body can say, hey, that's the bad guy, get out of here. So it's very effective, requires just the same normal freezer type stuff that we have. It requires 2 injections. The fourth vaccine is Johnson & Johnson. We haven't really received that yet. We're due to get it. This one is a one needle or one injection vaccine. It's also effective and does require the same freezer cold storage type of thing as the other three do, or the other two do, not the Pfizer. But it's also a little bit more ideal for people who might find it challenging to get the second vaccination. So when you look at people like our homeless population, people who are moving around a lot, this is the vaccine that's probably going to be maybe better for them. So what we're probably going to see with these vaccines is trying to figure out, matching out not only where do you live, where do you have access, but also what are your conditions that might affect things. So with the AstraZeneca right now, we're only injecting people who are 55 and older. And for things like Pfizer, we're only available in the larger centers. So there might be some adjustment. I think I could foresee this going forward, that there might be some adjustment depending on what your background is. I talked about Pfizer and Moderna being very safe for people who are immune compromised, for instance. So those might be choices as well. So again, we're learning about a lot of these pieces, but the good news is that these vaccines are effective. So the big ticket with the vaccine is we want to break these cycles of transmission, we call them. So what happens with viruses is we pass them along to each other. And when we do that, that virus gets the chance to live and to cause disease, but it also gets the chance to change and mutate. And that's what we're seeing now. We're seeing mutations that are happening, which is bad because as that virus mutates, it becomes better at what it's doing. It can move around a lot easier. It's easier to catch the disease. It can be more severe. So that's why we're seeing now people that are becoming what we think are sicker actually in a younger population. So there's lots that we can do. And the idea with the vaccines is that when we vaccinate enough people, that virus won't be able to move around, because the virus actually doesn't move around. It's the people that move around, and then we pass it along to each other. So if we can stop that, we can actually stop the virus, and we can actually stop these mutations. And when we get something that we call herd immunity, which we think means about 70% of the population being vaccinated, it means that the likelihood of that virus sticking around and causing all the problems that it is are pretty low. So we can manage it much easier at that stage in the game. So I think I'll just leave it there. I'm sure people have tons of questions, and I can talk about this a lot. I'm one of those geeky people that love all these science things, but I'll leave it there for now. And just know that, I guess the other thing I should say about the vaccine is that the way it's been rolled out is quite different depending on where you live as well. Because we had so many people in our north with the virus, we actually have been vaccinating people 55 years of age and older as part of phase 1. Of grave concern to myself is the fact that we know that the risk in our Indigenous populations is quite high. In fact, a 40-year-old Indigenous person has the same risks as an 80-year-old non-Indigenous person. But we're rolling out the vaccine based on age alone. We also know there's other things that cause higher risk, comorbidities, renal disease, all kinds of different things that are going to make you more prone to this disease. So, I know that there's been some modifications to how they are put. And when I say they, I'm talking about the health authority, Saskatchewan Health Authority, in combination with the province, because those decisions are made more at a provincial level. So lots of things to talk about with this vaccine. I look forward to hearing your questions, and I look forward to hearing my colleagues here as well. Thanks.
Thanks, Veronica. We're going to get some comments and some feedback of what's happening on the ground from Marg Friesen, the Minister of Health for the Métis Nation of Saskatchewan. So go ahead, Minister.
Thank you, Greg. And thank you, Dr. McKinney, for that explanation about the coronavirus #1 and about the vaccine rollout plan for Saskatchewan. My name is Marg Friesen. As Greg mentioned, I'm the Minister of Health for Métis Nation Saskatchewan. I'm also the regional representative for Eastern Region 3 of Métis Nation, and I'm glad to be here, honored to be speaking on behalf of Métis Nation and having this conversation with you about COVID and the COVID vaccine plan for the province of Saskatchewan. Some of the challenges that Métis people are experiencing, of course, as Dr. McKinney has has highlighted is that Indigenous people of this province, experience disparities in health and healthcare and wellness outcomes for citizens of this province. So that creates another layer of risk for Indigenous population here in Saskatchewan. Primarily, I'm going to speak about Métis citizens. Of course, Métis Nation citizens fall under the jurisdiction of the government of Saskatchewan for healthcare and healthcare needs. So we are left out of the equation when we're planning with Indigenous Services Canada and the First Nation Inuit Health Branch of Canada for vaccine rollout and for COVID response for Indigenous people of Saskatchewan. So First Nations and First Nations communities are supported by ISC and the federal government to ensure that they have access to health care, and primarily those COVID supports and the COVID vaccine. And the rollout has been very specific for First Nations communities and citizens. However, with Métis Nation and Métis citizens here in this province, we have relied on and supported and collaborated with the province of Saskatchewan to ensure that we have equitable rollout plan for Métis citizens. And there's been some challenges to that. I must be honest with you, it's been inconsistent in Métis communities, and as Dr. McKinney has suggested and emphasized, is that of course we had community outbreaks in the north and far north of this province, primarily Métis heavily populated communities, and so the attention was initially with those communities that were experiencing outbreaks. So Métis Nation had developed a response plan to support those communities and citizens to be effective in a way that we would contain those outbreaks and support those communities in the way of direct support and relief to citizens and communities with isolation support, with food insecurity issues. So we supported with food supply chain, with personal protective equipment. There was, as you recall, this seems quite a long time ago actually, but it's been a year now that we've been under this veil of the COVID pandemic. And Métis Nation has been on the ground in the front, providing support to not only individuals and families, but also to those communities who are experiencing the effects and impact of COVID. So we've been assisting centrally, of course, through Métis Nation Saskatchewan, but also at a regional level and community level. So all regions have access to financial support from Métis Nation Saskatchewan, and that hasn't happened in a very long time. We've never experienced something like this. So it has been a large learning curve for our government and our community stakeholders to ensure that citizens are, number one, supported and protected through the impact of COVID. So regions are frontline as well. They are working to support citizens, primarily our seniors and our old people, families, including single parents, supporting families through, their children learning from home, providing that technology and equipment so that children don't have a gap in their education because they don't have access to technology or equipment. So we've provided that support. We've also provided support in the event that people have employment loss, or they've lost their jobs, or they have a gap in income. We've supported them by supporting bridge funding to ensure that they, have their bills paid and their rent isn't lapsing, or their mortgage payment isn't lapsing. So we've supported individuals through that as well, and we've also supported our Métis entrepreneurs. When they've had to shut down their business or start laying people off, we've supported them through that process through our economic development plan with our economic development affiliates, SMEDCO and CCDF. So it's very important that we provide this holistic support for addressing the impact of COVID, not only at an individual level, but also at a community level. And we've been very diligent about that. We have the entire government that supports our emergency response plan. And with that being said, we have not been able to provide that support without the partnership of the Government of Canada. The Government of Saskatchewan has been very respectful in the way of inviting us to sit at those COVID impact tables and also the rollout of the COVID vaccine plan. However, as mentioned, the plan is inconsistent for Métis citizens. The North has been well provided and have access to the COVID vaccines, whether or not they be the Moderna or the Pfizer in the first rollout of the vaccinations, and people who have identified as being high risk or have compromised immune systems. We've supported that. Now there seems to be some inconsistencies with the southern part or the central part of the province with Métis citizens because I'll just give you an example. In Eastern Region 3, we have 56% of our registered citizens are seniors over the age of 65. A large population over the age of 70, 80. So, of course, they don't use the technology. They don't do the online booking system and have had trouble staying on the phone to get access to make an appointment. So we've assisted them to support that process to ensure that if they want a vaccine, that they have access to getting a vaccine. And it's just a lot of assumptions made with our communities and population on behalf of the government of Saskatchewan that our citizens can book their own appointments for their vaccine. That's not the case in many circumstances. So we're trying to emphasize that and ensure that Métis citizens have equitable access to being vaccinated. And I want to thank Adele Panahi. He's been working at the front line, the Director of Health for Métis Nation Saskatchewan, working on the front line to ensure that Métis Nation has a voice at the table both with federal and provincial governing body to ensure that we are providing advice, but also providing the urgency and the need that Métis citizens are vaccinated. Dr. McKinney has also emphasized the people we serve that are invisible populations, like people who are transient or homeless or experiencing homelessness. How do we vaccinate those folks? And how do we communicate with those folks who are with those experiences that it's important to be vaccinated, number one, and it's important to ensure that you're following the health guidelines and safety protocols for COVID, for the impact of COVID, but how does a person who's experiencing homelessness access those resources? So that's a big question out there too, that we need to mitigate those risks for those populations. So I'll leave it at that. If anyone has any questions for us, I'd be more than happy to answer your questions. So thank you very much.
Thanks, Marg. That was great. I'm going to circle back quickly to Judy Pelly. And Judy, if you can just tell us about your experience.
Okay.
Yeah, that would be great.
Okay. Well, when we were first faced with this pandemic, it was of course panicking. Everybody was panicking, and I lived downtown Saskatoon, and saw like the world almost like it was almost apocalyptic, just looking outside, no people, no cars, nothing. And so it was really scary for me too. So I think in the first 2 weeks, I just sat in front of the television, watching all the chaos happening throughout the world, and not only here, but throughout the world. And so it was very scary, a scary situation for me. And at first, because Indigenous peoples, I'm from the era, that the residential school era, and as you know, that's not very far. It wasn't very long ago. It's only 25 years ago that the last residential school was closed. So we have this. A lot of the older people have this real mistrust of medicines, and mistrust of especially vaccines. So we start talking with other people, my colleagues, other old people. It was a fear. I was afraid, and I wasn't going to get it. And we start talking about they're going to poison us. We're not going to do this. And of course, that was at the onset of the pandemic. And as we went further on, I experienced looking at the science, the scientists, the World Health Organizations, and all the top scientists of the world dealing with this. And it gave me a little bit more of a comfort zone that I would see this. And one of the things that really changed my mind was that the doctor that came on from the Saskatchewan Health Authority, one of the head doctors, I can't remember his name, and he got his vaccination right on camera and wanted to reassure people. So that, to me, that's when I made up my mind, like, yeah. And also with the knowledge that that this was being done with the top scientists of the world. And I know that since I got mine, it was a bit of a ripple effect. People that my own circle was saying, no, we're not going to do this. They're targeting Indigenous people, they're targeting old people, and we're guinea pigs, that kind of thing. So as we started to talk about it, and I said, as soon as the vaccine comes in, I'm going to get it, because I trust in the scientists of the world, at that level. So when I decided I was going to get it, and it started having a ripple effect, and we started talking to the older people, and people that had said no, that we're not going to do this, have changed. And as a result, also there's there's a lot of our people that are immunocompromised, or they're compromised system, because, as you know, we're overrepresented in the healthcare system in everything, like specifically diabetes, cancer, all those things. And asthma, it's very high with our population. So our elders, some of our elders in our circle started to pass away with COVID, and also relatives. And so it started to open the eyes of a lot of our population that we need to, some of us need to do this. But I want to say too that I'm only speaking on behalf of my own experience, because there's still a lot of people that there's a choice, and there's still a lot I would say that are going to decide not to, and because that's their choice. And Indigenous people had their own medicines, and people are still relying on those a lot. And so I'm not going to speak on behalf of them, but only my own experience. And one of my close circle also was saying, well, he was very, I don't know if I'll get this or not, or it was a decision that he might not take this virus until he heard more about it. And then one of his close younger relatives died of COVID, and that was a turning point for him. Is, and this person had diabetes, I think, and he was young, like in the 50s, and he passed away. So this elder this older, the senior, Indigenous senior decided that, yes, I'm going to take this. So it's really had a big ripple effect. And I'm really happy with what the Saskatchewan Tribal Council has done. They've had, they're set up now at I think, Saskatchewan Place to do Indigenous population in Saskatoon. They have, I think it's with the Saskatchewan Health Authority, and I'm not sure who all the other partners are, but they're with Saskatoon Tribal Council that are doing vaccinations, and they'll be starting, I think, on April 5th, and it's on somewhere on Facebook, and people are really lining up for that. work in the community, and I know that we don't go out as much because of COVID, but what I'm hearing is, to me, it looks positive. And again, we all have choices, and I don't want to say that I'm speaking on behalf of anybody but myself. So with me, I got both vaccinations, and you know, when I first got the call to get my first one, I cried. I was so happy that I got it, because I was so, you know, I want to be here. I want to be with my grandchildren, and so on and so forth. And I knew that people look up also to one another, and I have a lot of friends and a lot of people that I respect and that respect me. So it's made a big difference that way. So and again, a hesitancy from some of our people is again, they have a choice, and maybe they'll change their mind. Who knows? But for now, it's I'm glad that we're not forced to, that it's a choice. So and with that, I really like to thank Veronica. I just learned a whole lot. Every time she talks, I learn more. And also Marg, and I'd like to thank you all for having me. And I'm here to answer questions if need be. Chimegwich, thank you.
Chimegwich, thanks, Judy. That was great to hear your personal perspectives. So we're going to turn over some questions to Dr. McKinney now. Veronica, the first question I'll pose to you is, so say if Judy came to you, she wanted the Johnson & Johnson vaccine, or she wasn't ready for the Pfizer vaccine. Are patients allowed to basically pick and choose what vaccines that they're going to get?
Yeah, the short answer is no. And in fact, it's a bit of a, you know, as we've heard, things are rolling out so rapidly, and I think it's a bit disjointed. So as a family doctor, I still see patients, of course, and I don't really have much of a say, even advocating yet for what vaccine people will get. We do know, though, for instance, that, as you know, Judy and Marg were saying, that there were, you know, places that the vaccines are being given. And generally you'd either get the call, or now with the opening up of vaccinations, you call in to book an appointment. So your best bet is to let the person know when you book your appointment, you know, look, I would really like to get this one. Is that a possibility? Here's the reasons why. But, you know, to be honest, just sort of picking and choosing is not going to be the option, I think, probably for quite some time to come. And that's, like I said, I don't know that they've got anything in place really to really figure out who might be best to get what vaccine quite yet. So fingers crossed that will be coming, but we don't have that option quite yet.
Thanks, Veronica. Yeah, I know, like, it's very age dependent on wherever the clinics are happening, whether that was like where I was working on some of the First Nations communities, you know, and if there was extra doses, we'd kind of move down the age a little bit. But again, like you said before, like if the average life expectancy in Saskatchewan was X for either men or women, the average life expectancies for Indigenous populations are sometimes 8 to 10 years younger than that. So, you know, and I think in Regina, we're doing anyone over 50 can get their first dose now for some of the Indigenous populations, which is great in some of our urban clinics that are specifically focusing on our Indigenous people here in the urban areas. But again, it's a mixed bag. So do people, like, where does people go? Do you go to the Health Canada website, or is it better to go to like the SHA website? Where's the best information for people?
Well, I think it depends what information you're looking for. To be honest, probably the Saskatchewan website will give you the information that's applicable here, and especially if you're looking to find where you can go to get a vaccine and to call in and book in. But as Marg was saying, you know, it's not as simple as it sounds, and it makes the assumptions that people have access to, you know, internet and to computers or smartphones, and that you can wait, and that your cell service is good, or, you know, all these different pieces. And I think really the unfortunate part about this is we don't have one system in our province. We have a federal system and we have a provincial system. We have two health authorities, not just one. And there, again, this is all really highlighting the fact that there's not a lot of working together, and there's this idea we can just apply everything to everybody, and that means that it's equitable. It is not. So I think really that's where we try to advocate, and where I see people like the Métis Nation or, the Saskatchewan Tribal Council, for instance, really trying to fill in those gaps, because there are a lot of gaps, and it really means that people don't have access. Basically, what we're saying in terms of the vaccine, and I've been saying this all along, take what you can get. If you get offered the vaccine, take it. I have vaccine envy right now, because even as a healthcare worker in the front line working inner city, I don't qualify yet for the vaccine. So I'm with you, but I'll take whatever I can get. Despite that, I still, I think I was glad you mentioned traditional medicines, Judy, sorry, because a lot of people are using that, and it's not to say you have to choose one or the other either. When you think about how devastating it is to have, us all be on this lockdown and stuff, being able to participate in ceremony is so important, and being able to have our traditional teas and things like that. But I always caution people, our traditional ways or medicines are not about a medicine. That's a Western concept. Some of it is, but a lot of it is around how we are living our lives every day to be healthy and strong people, connected, all of these different pieces. And then there's another spot where I really see our communities are stepping up, our Métis Nation, our tribal councils, really making a big difference. And I think those are the things that really keep us healthy. So anyways, that's my little speak.
Yeah, so a couple of comments and a couple of questions. Adele has basically said that the province didn't originally accept the NACI recommendations on Indigenous populations, while other provinces prioritize Indigenous populations for the vaccine rollouts. And Val has kind of got a related question. What do you feel are the perceptions in Indigenous communities in the North compared to the South, and what have you been hearing out there?
Well, in our North, I mean, we've been, I call it lucky or fortunate, because we have had access to the vaccine compared to elsewhere, because people have seen firsthand the disease, how much it's really limited people from moving around. It's not just about the disease itself. I remember a story of one of the patients who was a chemotherapy patient and who needed to go down south to Prince Albert to get her treatment. And when she got there, even though she booked her hotel room some time ago, because she was from a place where it had been announced that they had positives, they would not rent out the room to her. So her only option was getting in touch with, a distant relative who happened to live in Saskatoon, drive all the way there, drive back the next morning to go to PA to get her chemo, and then back up. I mean, that's one example. I mean, we know of people with surgeries that have been canceled, getting access to specialists. I mean, there's just a myriad of things that have been put on hold right now. So we know that this is affecting many things, and there's many layers, and I don't know that we have a good way of capturing all of that. But in the North, I think when people have experienced that and have seen these things and have seen the deaths, people want the vaccine. And I think we are sitting at something like 93 to 99% vaccination in the Northwest and the Northeast. And I think the far North is around 88%, which are actually pretty high rates of vaccination, to be honest. So this idea that people are afraid of the vaccine, I think has actually gone by the wayside. When you look down south, many of our Indigenous communities have not even been offered the vaccine. And again, I know Health Canada has offered to even drive people in, like we'll bring them to the major centers, just let us have access. But that hasn't gone anywhere. And so what you see is a difference between what the federal government recommends, so that's the national guideline, is to in fact vaccinate our Indigenous peoples at a much younger age because of this higher risk. But some of that has been taken up by provinces and some have not. So each province individually has the option to do what they want to do. And that's, I think, where some of this disparity comes in. So it's challenging. And I see Marg would like to respond, so I'm going to keep my mouth shut here.
Yeah, I was going to go to Marg next. Marg, if you can have some comments on that, then we'll go to, I think, Dr. Tate, and then maybe Dr. Sakamoose after that.
Thank you, Greg, and thank you, Dr. McKinney, for raising that issue of inequitable access to vaccinations, yes, of course, there is a definite difference from northern communities to southern communities. We are experiencing that here in the South. It's like they don't think that Métis people live throughout the province. They only think Métis people live in the northern part of the province, which is not the case. We have just as high as a population down here in the South, if not more, than the northern communities have, residents or Métis citizens. The vaccine rollout plan for Saskatchewan, we have encouraged collaboration with Métis Nation. Our communication strategy for Métis Nation Saskatchewan being consistent is very important, informing our citizens the importance of those safety protocols and those guidelines, and informing our citizens and communities about the health restrictions and the further restrictions here in this province. We have been collaborating with the province of Saskatchewan to ensure that our Métis communities and citizens are informed, and are informed with all the provincial guidelines. And we have also encouraged them to listen to Métis Nation Saskatchewan when we say, this is inequitable. This rollout plan does not include Métis citizens. We experience a higher risk, as Dr. McKinney has stated, and there are a number pockets of Métis populations throughout this province, and the southern part of the province has been an afterthought, in my opinion. That's expressing my frustration with the whole plan to vaccinate all. So we have been lumped into the general population with the sequencing of age groups and categories. However, in the meantime, our Métis citizens are experiencing a great deal of challenge ensuring that our population is considered in a higher risk and being considered as a priority for this province. And we still send that message to the government of Saskatchewan and the Saskatchewan Health Authority. And they've been very gracious with accepting our response. However, the actions don't match the words. So it's created a lot of confusion among Métis citizens, and inconsistency with communications from the health authority. They've done a great job. Don't get me wrong. I really support the health authority with their rollout plan and with informing citizens generally. However, with Métis Nation, they have to consider us as a part of an Indigenous population that requires further support and consideration, particularly through impact of COVID and ensuring that our people get vaccinated and have access to the vaccines. Thank you.
Thanks, Marg. We'll go to Dr. Tate next.
Yeah, hi, and thank you. I'm enjoying this. And so I have a question that came up, and Dr. Lambert, I think, is on as well. So we met with, so we have this project right now looking at emergency response and disaster relief, and Métis Nation's a partner of ours. And so the question of evacuation, so we're about to head into fire season and flood season. And so what happens when you have a segment of the population, so vaccinated and another segment not vaccinated, and what do you do in terms of rollout of emergency evacuation and where people end up if there is, and we know from previous research that there's stigma associated with people, regardless of whether there's COVID or not, of people coming into communities like Saskatoon and Prince Albert, and that people are facing racism and other types of really negative experiences. Now with COVID, and last year in Saskatchewan, I think we had one evacuation of one First Nations community, but other than that, it was a relatively quiet season. And so of course, ISK supports First Nations on reserve. But then we have Métis and non-status that are off reserve that aren't supported in the same way. And my sense is that people end up going to relatives in other places when they need to be evacuated and that. So can you guys speak a little bit about the dilemma that you see that may occur this summer if we have a high fire season or flood season? And I have to say, Adele, I love your hat. So yeah, so that's my question.
Dr. McKinney, do you want to answer that one?
Sure. I mean, it definitely is a major concern. I know there's been some meetings that have started up about this because, you know, probably about 5 years ago, I think it was, we had horrible forest fires throughout the north where we had mass evacuation of some of our largest communities. And, you know, putting people like in the soccer center, sleeping on cots, not going to fly. And we, at that time, we were putting people in PA, Saskatchewan, Regina, Cold Lake even. So I don't have a good answer for you. I think we're going to be in dire straits. There's just no two ways about it. I think our best hope is to try to get as many people vaccinated as quickly as possible so that when we, you know, if we do have something like that occurring, that, you know, even when we have no choice but to put people into some kind of, you know, I'm sure there will be some sort of communal living of some sort, probably try to separate as you can, but it would be limited. I think we're going to have limited facilities so that hopefully if we can get some of that vaccination occurring, that, you know, we will try to do the best that we can, but it's a major concern, you know, and we see this every year. There are different things that occur. And then not only, you know, with the forest fires, but it doesn't even necessarily mean you're evacuating all the people. Sometimes with the smoke and such, as you know, Judy mentioned, people with asthma or people with any kind of respiratory illnesses, it's challenging. And then to try to get down to where your community people are in terms of, you know, maybe somebody that you know living in Saskatoon or such, they're then living in overcrowded housing, and 9 times out of 10 they're in overcrowded housing and not the best housing as it is already. So again, it really highlights the disparities that are already in existence.
Thanks, Veronica, for that response. We'll go to Dr. Sasakamoose, and then I've got a couple of questions from the chat.
Hi, thank you. I just have a question about the vaccine rollout, and you spoke a little bit about the 2 different health systems, the feds and the province. And so one of the challenges that I think we face is we hear the province say that the directive for the vaccine rollout came from the feds, and so that while they, yes, can roll out in the manner the province can roll out in the manner they choose, if the directive is, for example, in Regina, that you have all resources going to 3 drive-through vaccination sites, 1 in White City and 2 Regina, and that's the directive, then how can the health authority actually do something other than follow the Fed directive? And so as a person who I consider myself a little bit lay, not understanding these funding schematics, how do we navigate these passing of the buck between the province and the Fed, the province and the Fed? We as you, as Saskatoon Tribal Council is doing, and as we are doing in Regina, are taking care of our own, but that's a Band-Aid. So any suggestions on how we navigate this sort of, you know, the provinces control the rollout, but the Feds give the directive?
Well, that's a great question. I think it's the age-old question. I think anybody that has worked within these 2 scenarios knows that's exactly right. They do pass the buck back and forth. I don't know that the directives are necessarily being followed. I mean, they're being looked at, but I don't think that, like, the directives that are being provided are not necessarily implemented in every province. And I think that's part of the issue. You know, and I don't have a great answer for you, because I know, you know, as Marg suggested, there's been numerous committees and all kinds of different things formed, lots of direction and information provided, but ultimately those decisions rest with the province and they don't rest with anybody else. So they kind of give the illusion that there's other people being involved in the decision making, and they may or may not take that information to heart, but at the end of the day, it's with the province. So yeah, sorry, Marg's nodding her head and she wants to speak, but I think we just have to keep bombarding the province because they are the ones that have the power for implementation.
Marg, go ahead and respond to that.
Thank you, Greg. Yes, Veronica is correct. It is a jurisdictional issue. Ultimately, First Nations citizens, First Nations peoples and communities rely on the jurisdiction of the federal government or the government of Canada. So they work directly with Indigenous Services Canada, and Métis Nation works directly with the government of Saskatchewan because we fall under that jurisdiction. So it's really not a directive from the federal government. It's actually a suggestion that you include and respect Indigenous populations of the province in your COVID vaccination plan. And so it is up to the provinces to determine that and what that looks like, and to collaborate with those Indigenous governments and populations or Indigenous stakeholders. And unfortunately, it remains inconsistent. That's my word of the day. It's really inconsistent from north to south, east to west in this province on how Métis citizens are being supported, and it's frustrating. So we encourage the government of Saskatchewan to continue to listen to Métis Nation as we represent, potentially 80,000 people of this province. And we are Indigenous population with inherent rights, and one of those is healthcare. So we insist that we be front and center along with our First Nations colleagues, peers, family, and communities.
Thanks, Mark. We've got a question that Val's been patiently waiting to have answered. And her question is concerning blood types. And does blood type matter? Is one protective? Is it better if you're O positive like myself, or if maybe someone's AB negative? What is there anything with blood types and COVID or with the variants?
There was one very small study early on that talked about O positive potentially being, I guess, more protective versus A positive, I think was the one that they identified as being a little bit more susceptible. I don't think that there's been much work done on that. And to be honest, from what I was reading on it, I think that there's such a little bit of any identification of any protection. Like when you think of how many millions of people have been exposed to the virus and how many people have had it, I don't think that we're really seeing anything clearly around blood types per se. I wouldn't completely discount it, but I think there would need to be more studies done about it. But I don't think we're seeing anything that's really like, neon sign kind of flashing. This is a big thing, which is unfortunate because I guess as Indigenous people, most of us are O positive, not everybody, but a lot of us are. And it'd be nice if we had that. I'd take it anyways.
So Dr. McKinney, the question that kind of leads from that is with the variants. I'm living in here in Regina, Saskatchewan. We're locked down till April 12th, so don't come visit. And I won't be visiting you guys for a little while. But what about these variants? Like, I know you touched upon them a little bit, and you said that the variants sometimes make things more virulent. But I've also read that sometimes if it's a different variant, it can make things more benign, like the common cold. So can you just tell us about what your thoughts are on the variants?
Well, I think, yeah, you're absolutely right. Viruses change. I mean, they mutate, they change. This is to be expected. But what the concern is that there have been variants that have been identified that are much better at making us sick. So and what's going on right now, the highest variant in Regina is one that makes people much more likely to get sick from it. And it seems to be infecting younger people. The other thing that I hear just across the country in general from my colleagues is that they are seeing people that are younger and more sick when they come into the emergency department. So even more sick than what they were the first and second surge of this. I think the concern about it is that you're right that there can be variants that maybe would be more benign, but then the chances of those ones being transferred are not high. So the ones that are going to cause the biggest problems are the ones that are more easily transmitted and are the ones that are going to cause the most damage. So until we can get that herd immunity, if you would, if we can get enough people to stop the transmission and not be able to pass that virus along, it's going to mean that we may in fact see a lot more problem. And in fact, with this current situation, what we saw in Ontario and are continuing to see are staggering numbers, I would say, of variant. So that the model of prediction is that they could see, you know, close to 5,000 to 6,000 or even more positives per day. We lag behind that, but we're heading in that same direction, unless we can stop it by, you know, things like keeping people on lockdown, keeping all the protocols up as much as possible. So the more we can stop it and the earlier we can stop it, the better it is. And I caution people because, you know, when you hear about the variants, we forget that the reality is that your positive test is probably means that you were exposed to this virus, you know, 10 to 14 days before you got symptoms. So your positive test is now 2 weeks old. The variant is then tested on all the positives. That could be up to another week. So we're talking what we're seeing today is 3 weeks behind. So I can tell you those variants are out there in the communities. We need to try to really protect ourselves and our families and our communities as best as possible by trying to break that transmission.
Thanks, Veronica. So you talked about the variants, talked about the vaccines. So you haven't had your vaccine yet. I was happy to get my first dose of Pfizer when I was vaccinating a couple of weeks ago. So how long after, you know, say Judy or myself or you get the vaccine, how long until we're, as the question is, fully protected?
Well, that's another good question. You know, I guess when we talk about what's fully protected. So first off, with the vaccines that we have right now, so that includes the Pfizer, the Moderna, the AstraZeneca, they all require 2 doses. And that's to receive the full immunity. Does that mean that we can stop wearing masks and we can stop doing, you know, start reliving life the way that we did? Not really, not until we get enough people vaccinated to really prevent that transmission. We have seen, and we've seen this, I've seen this already right here in Saskatchewan, where we've had people who have had a vaccine and actually have had 2 doses and have turned up as being positive. They had no symptoms. They didn't know they had the virus, but they were able to carry the virus. And so they didn't know that. So it's a wake-up call to show that, you know, even with the vaccine, like I said, the goal of the vaccine is to keep you out of that graveyard, keep you out of the hospital. And it is to prevent that transmission piece, but that doesn't happen until we get enough people vaccinated. So there's, you know, it's kind of a layered thing. So there's things that you do for yourself, but there's things that you do for your community, and that community piece is going to take longer to see the effects of that. And when you've had one vaccine, that does help as well. We know you start to make antibodies enough to actually start to fight the virus at 14 days, but you will still need that second shot, and we will still need enough people to get that vaccine to make that difference.
So if I got the Pfizer for my first dose, can I get the Moderna for my second dose and I'm good to go there?
No, actually, you need to have the same vaccine. We don't have studies about doing different vaccines because they are, you know, a bit different. So you do need to have that same vaccine. And so again, part of this is you can imagine the amount of work that's required to really make sure that they've got everything down. What vaccine did you get? Who's going to be eligible when it's due? All of these different pieces. And, you know, I think, you know, that's the part that I feel sorry for the people working at this, because they're really having to keep this quite precise and keep all these records. The other thing to keep in mind is at some point we may need to have that vaccine history to prove that we've been vaccinated to go anywhere, you know, traveling, that type of thing. So it's quite a process right now. We don't have any indication we can cross vaccinate with one or the other. So you really do. And they are even, so for instance, for some of our people that work up north, but they come back and forth, for instance, if they got their vaccine up north, they have to get their second shot up north. So it really does have to stay in the region, which is also a challenge.
Yeah, Marg wants to respond, and then I've got another question.
Great questions, by the way, from the people who are listening and watching. I just had a question for Dr. McKinney as well, and to emphasize the encouraging people to get their COVID vaccinations. It's like like, what did you call it, Veronica? A herd, like a crowdsourcing. Once one person gets it, and then you're protecting yourself, and then your immediate health bubble, and then those folks get it, and then it's like a ripple effect, and then soon well enough we're seeing lower prevalence of COVID impact on Indigenous populations because everyone's been vaccinated. It doesn't mean that you're immune anymore. It just means that you're protected in a way that, as Veronica mentioned, it keeps you out of the cemetery. You won't die. You might get sick, but you certainly are not going to lose your life because of COVID. So that's what we're reinforcing with Métis Nation, and in terms that people understand too. Science and technology, or science and technicians, is wonderful to understand at that level. But when we're talking about community level, people really need to understand, okay, what if I don't get the vaccine? What if I choose not to? How's that going to affect me or my family? But what if I do? How can I support that? So that's where we're at with Métis Nation Saskatchewan with our comm strategy. The other thing is the data that's going to be collected for Indigenous people, and how we're going to reference that data in the future with a crowd vaccine plan, right? How can we support that data? How can we influence that data for future health outcomes for our people? That's really important as well.
So Marg, you raise a good point there. So currently, University of Saskatchewan researchers are leading 2 pillars of a national COVID-19 response network, and that's funded by CHR and Health Canada. And in one of those pillars, Indigenous community-based research initiative, the other is looking at public health measures. I'm just wondering, is Métis Nation of Saskatchewan and/or Northern Medical Services involved in these 2 proposals, these 2 kind of research proposals that U of S is leading? And if not, are you guys going to be involved?
Yeah, I'll answer.
I think it was like $9 million. It was like a big money.
Yeah.
Sorry, I'm just holding up what came across our feed. And that because our research center didn't know anything about this.
I will answer that very, very shortly, Greg. The answer is no. We were not aware of any type of research on Indigenous populations in this province for COVID. We were not aware. We weren't informed, nor were we invited to participate in that research. So it's very important that it comes down to the bottom line: nothing for us without us. And this has been historically an issue with researchers coming into communities and collecting all kinds of information on our people, and we are not aware of how that research is being used, who has access to that research, and who's stewarding that research, who owns it. So that brings us to a whole other level of data sovereignty, right? And how we're protecting our people and the information that researchers are collecting. So no, we're not involved in that research.
I like your short answer. And it's good that it was. I'm sure you could go on. Dr. McKinney, Northern Health Services, have you guys been involved in any of the kind of current research?
No, not in that one in specifically. And to be honest, no, we're not. There's been a few different research projects, of course, that we're involved in, but that's not one of them, and certainly not with COVID. Which again, I echo exactly what Marg is saying. It's very sad to me. I mean, we have Tri-Council 9 guidelines very clearly stating this. We've got processes to allow this to happen. OCAP, But, at a university level, it's very much about money and competition, which I think is at the root of the problem with research. It's about competitiveness. It's not about working together. And I think we need to change, that needs to change, to be honest, to make a big difference in how this is approached.
Well, and I think Marg said a good nothing about us without us is like, it's doing research on and doing research to people is the way that we've left that way in the past. So Indigenous people need to be involved in their own sovereignty, especially when research is coming about. I need to revisit the blood type one again, if you could just, and I'll kind of ask you just to rephrase that one. Someone missed that conversation about the different blood types, but then I'll also kind of go back towards the Indigenous population of Saskatchewan and owning their material and biobanking and where these potential blood spots or saliva tests, or what happens to our saliva tests once we send it to Prov Lab, who gets to ultimately keep that? So if you can talk about the blood types first.
Yeah, so blood types, what I said was that there was a small study that had been done, like quite small in relativity to how many people have had COVID and the outcomes. At that time, it was early on, it showed that perhaps those with O type blood were a little less likely to get COVID, and those with A were maybe a little more likely to get COVID. It hasn't really been demonstrated to play out in real time with the numbers of people that have had COVID, but I'm not sure that there's much studies done about it. So I don't think it's something that's a big enough factor to really say is a major factor, let's put it that way. But I think obviously there would need to be more study on that to really discount that or to show that it's true. In terms of the saliva tests, my understanding is there's been very little rollout, to be honest, of saliva tests as of yet. And this has been a source of frustration for many people as well, because apparently there's lots sitting in storage someplace. But when tests are sent in, whether they're saliva tests, nasal swabs, whatever they are sent in, and the test that has been ordered on them is what is tested on. They don't test for anything else. Once that test has been completed, they keep the samples for a certain amount of time, usually maybe a week or so, and then they get rid of those. So it's not like they keep it for the DNA or anything like that at all. It may be different for a research project. So again, that would be an important factor to consider if things like blood is taken or saliva is taken and all of those things. Those are important things to check on and to see if they would be stored and how long they'd be stored for and who would have access to those types of things, because there's a lot that could be done without people's knowledge if they're not aware of some of those factors.
Yeah, I know currently there are some, there have been requests for people to do blood samples, especially when they have been positive and recovered, to start like almost biobanking the plasma samples and to see if medicines can be made out of those and potentially profits down the way. But, but anyways, I'll leave it there. Jolie, you've got your hand up still. I'm hoping you have another question.
I do. Actually, I just wanted to follow up a little bit on what Margaret was talking about. I was at a vaccine meeting, kind of a town hall at the U of R, led by, I think it was a biologist and some other, high science kind of researcher. And they dropped a lot of words like, we're working on an education strategy. We're working with marginalized populations and remote communities, and said all the right things. But at the same time, most of the people in this group know that we just submitted with Hassan and the SHA and the head of COVID vaccination for the province, and no one ever heard of their work. So why is that? So I asked the question, like, could we connect after to kind of see what work you're doing, and sounds like maybe even funded for. So I'm hoping to have that follow-up meeting too and bring that information back to the NEAR to find out who this crew is that's saying they're doing this level of work and research. And the other thing I just, why I put my hand back up again is, as Indigenous people, especially those who are more aware on the global level, I've been getting questions about the Cuban vaccine and the fact that the Cuban vaccine is not pharma driven. It's actually, as we know of Cuba's healthcare system, it's humanistically driven. And so there's 3 vaccines in Cuba right now. Cuba's actually kind of doing a sort of plan on, come get a holiday and get a vaccine. But the thing about the Cuban vaccine, it's very, very interesting for many reasons. And I have not heard anybody in any country outside of Cuba discuss its potential implications, and discuss like its good-natured approach at development. So I wonder if we could start to, as Indigenous people, have the conversation about our own people developing vaccines and what that might look like, and how we can at least get the information about the Cuban vaccine out there.
Thanks, Jolie, for that. I'm not sure if anyone knows too much about the Cuban vaccine, but I want to go to Marg first, and then we can maybe circle back to the Cuban vaccine. Marg, I know there's been a question in the kind of chat that you want to kind of address. You're on mute still.
Thank you, Greg. I just want to respond to Samantha's comment about OCAP and Métis Nation's principles on collecting data and data sovereignty. Métis Nation Saskatchewan has developed guiding principles and data governance principles, and actually a framework that was presented to the Provincial Métis Council and the Legislative Assembly over a year ago as a report. And we're just soon to be creating a stronger foundation with that governance framework, and with the assistance of Dr. Caroline Tate and her team and the network, we've been able to produce something that's pretty similar to OCAP. However, it's Métis specific, based on cultural responsiveness to Métis citizens in Métis Nation and Métis Indigenous researchers, or any researchers for that matter who want to collect data on Métis communities and citizens. So we have developed that framework. So we're just in the process of implementing that framework with all researchers that we connect with on research activities and projects throughout the province of Saskatchewan with Métis Nation. Thank you.
Thanks, Marg. Samantha, you either had your hand up or you think it's a party now, but Samantha, do you have a question? If you don't, you can just stay on mute. Okay, that's okay. I want to bring Elder Judy Pelly in. Sorry, called you Elder again. Judy, someone has asked, and this is, I want to get your thoughts on this. Basically, how are some ideas that kind of we writ large can communicate to Indigenous communities? Saskatchewan Health Authority has made probably some posters in different languages, maybe broadcasting or something. I don't know if that's happening or if that's a thing, but when you go back to your home community, I don't know if you've been back to your home community lately, but how is the message getting out there, either about COVID itself or the vaccines? And what do you think would work better?
I think, first of all, social media has a lot to do with some of the negative and positive information that's going out to the communities. I know that I was watching a conversation about a negative one about vaccines, and then there was just a whole bunch of people like, yeah, me too. Like somebody said, here we are being used again as guinea pigs, and you know, that whole conversation, and a whole line of people, no, I'm not going to get it. No, I'm not going to get it. No, I'm not going to get it. And then the same with the more positive information is like I went, you know, I even went on there and said, well, I'm going to get it for that because I know, like, you know, what I just said about my own feelings toward it, and a lot of positive came out of that. But social media is very, very strong out there, especially Facebook, when people start saying things, and it just has a ripple effect everywhere. And another thing is for me, like I said, I went public when I got my vaccine, and I've been double vaccinated by the Pfizer, so I'm very, very lucky. And so as I carry that on, then you know, it's like a ripple effect. People start to, and then I want to also share that in our group of elders in Saskatoon, like I'm here saying elders also, the Knowledge Keepers, there's a group that it started off with about 15, and I think we have about 70 now in Saskatoon, where we call it's called a survivor group, and there's a couple that coordinates it, and so we have just recently got a whole bunch of iPads and been trained on them. So old people, they have relatives, they have like they have big circles. So I think that's one way of that we're doing it is we're sharing this information. I think that we have approximately 50 or over that have iPads that have been trained. And these are old people up to about from 50s to 80. And it's been actually a lot of fun watching the training happening. So and then also the Saskatoon Tribal Council in there. And I wanted to say that according when somebody talked about jurisdiction, it's also a partnership with STC, the Indigenous Services Canada, and the Saskatchewan Health Authority. So there is a federal component to what's happening there. And they also have elders on hand, and they also have language speakers on hand. And so that it's a safe place, and people are hearing about it, and they're going to, like there's especially language. When you hear somebody speaking your language, there's automatically trust happening there. That mistrust is broken down, and so I think that we're looking at that as a positive event that's happening, and that it will really reach a lot of people. And yeah, so social media has got a lot to do with it. And the more people that go up and say that, like that are positive about the vaccines and what the scientific community has developed, the better, the better it is for everybody. But again, like I say, that I have a lot of respect for some of the elders that I spoke to just even as recently as yesterday, and that they just want to have a choice. If they want to stick with their traditional medicines, and then you know what, that's their own prerogative. It's up to them. So I'm happy with that they do have a choice. So yeah. And with that, I'd just like to thank you again for having me here. And any questions, I'm here. Chimegwich.
Thanks, Judy. Yeah, and I think as long as people are making informed choices, if they're getting the real information, then it's obviously an individual choice, and we make population and public health decisions based on kind of best practices and wise practices, as the elders have told me. I'm just going to remind everyone that our next webinar is on April 15th, and we probably got time for about one more question. And I'm going to ask Dr. McKinney this question. So I know it's been in the news kind of in the last couple of days from WHO. Where did this COVID-19 come from? Did it come from the lab? Did it come from an animal? And is it even important at this point in time in the pandemic of where this came from?
Yeah, well, I think from as near as anybody can tell, I mean, it obviously did come from animals. They think it's more from these brown bats, and that there was another animal vector, and then that transmitted to humans. We know that the first cases came out of Wuhan in China, but it doesn't appear that there's any way that this was sort of done in a lab, or that there's this. I think there's been a lot of theories around, this covert kind of, we're just trying to take over the world kind of theories, I guess you would say. But sadly, if it were, I think it'd be a lot easier to contain, but it's not. And I think, the reality is that this is part of a natural history. When we look back in history around viruses, we know that there are cycles. And so we know that we were due for a cycle that would be a major situation such as this. And we know that we have had transmission from other animal sources in the past as well, and these are of concern for us. We've seen that multiple times. So no, it's not a lab created situation. I just don't think we're that smart yet to do that. But the reality is, I think that this is from the animals, and that's where some of the work around working around like vet med and medicine working together to try to look at what are some things that are occurring and how can we maybe break some of those chains of transmission, looking at things like, what about our meat supply or our food supplies, and how is that being affected by viruses? because viruses are pretty gnarly. They're pretty amazing little tidbits that can really cause a lot of damage, or conversely can be very helpful sometimes. So yeah.
Yeah, and lots of those one cell organisms were here ever before we got here, and they're going to be here long after we're gone. We've got about 2-3 minutes left, and I'm going to go to Marg for kind of last comments. And where do you see us going in the next kind of 6 months or year, Marg, in kind of your neck of the woods, and even for the whole province? What are your insights?
Thanks, Greg. Well, on behalf of Métis Nation Saskatchewan, I think we will continue to see the impact of COVID on a from citizen to citizen basis, or even experiencing community outbreaks with these new variants in Saskatchewan taking hold. Unfortunately, there are folks who don't comply with restrictions and are continuing to travel interprovincially and not self-isolating as recommended to do so. And then of course, we didn't talk about being asymptomatic and potential spreading the disease that way. So we're going to be experiencing, a greater need for COVID support. We're still encouraging people to be vaccinated, following the health restrictions and guidelines and the protocols set out by the province. And we have to stay vigilant about that. We can't become complacent, because when you let your guard down, that's possibly, a risk to you, risk to your family, and risk to community. So we're reinforcing those communications and supporting those communications by the government of Saskatchewan. And from Métis Nation Saskatchewan, we are just hoping that people stay safe and support those guidelines and get vaccinated. Thank you.
Well, I'd like to thank Marg. I'd like to thank Judy. I'd like to thank Veronica for everyone coming today. And please make sure to sign up for April 15th, Racism in Healthcare. This event is going to be big. I know we've probably got over 250 people signed up already. So make sure you get your name in there and share that with your friends and colleagues and family. I put the link for my Sask Health Record whatever it is, but it's my Sask Health Record. Go on that. I know some people do have trouble getting onto that. So work through that. Your test results will come back way quicker. You can see all your kind of health information there. So again, thank you for the presenters today, and thank you for everyone who asked questions today and everyone who attended. So this is being recorded, and you can check it out on our Facebook page or on our webpage. So thanks everyone for coming, and we'll hopefully see you in a couple of weeks.
Thanks to you, Greg, as well, for being such a great host.
You guys made it easy.
May great
Merci. Thank you, everyone.